to the staff of Hong Kong Hospital Authority who are on strike. Medicine is a profession. It's distinguished from other professions by a special moral duty of care to save lives and to relieve suffering. Medical ethics emphasizes the priority of this moral ideal over and above considerations of personal interests and private gains. This is from Introduction, Code of Professional Conduct of Registered Medical Practitioners. I think you also have recite the following oath. I solemnly pledge to dedicate my life to the service of humanity. I will practice my profession with conscience and dignity and in accordance with good medical practice. The health and well-being of my patient will be my first consideration. So what's happening right now? As of 7 p.m. on the 5th of February 2020, preliminary counting by the HA indicated more than 5,100 employees were absent from duty, including about 300 doctors, 3,100 nurses, and 1,000 aligned health professionals. In one instance, more than 50% of the nurses in one newborn intensive care unit and over 100 staff of an ER were absent, resulting in the closure of that ER. The aim of the strike is to pressure the Hong Kong government into closing all borders of Hong Kong in view of the coronavirus epidemic. This strike does not fall into definition of strike under the Trade Unions Ordinance, Chapter 332, or Section 21B of the Employment Ordinance, Chapter 57, on the rights of employees in respect of trade union membership and activities because it is politically motivated and is not for the purpose of negotiating terms or conditions of or affecting employment. Further, as the Hong Kong Hospital Authority has no ability to control immigration checkpoints in Hong Kong, in taking industrial action, you are impeached of your employment contract by being absent from work without leave and consent on grounds that have nothing to do with your terms of employment. This is nothing but a reprehensible act of public health sabotage. You say you are going on strike to protect the public. However, by not attending to your job, you are forsaking the health of local Hong Kong patients who rely on public healthcare system and put their needs at risk with utmost immediate effects. When you took this job, you made a solemn promise to take care of your patients and not have the patients delegated to others. You are putting your political goals ahead of your patients' lives and at the same time the greatest need. You are not sacrificing yourselves. You are sacrificing another human being, another patient, another Hong Kong citizen. Patients who have waited a long time for certain procedures will have to wait even longer. Those who have chronic diseases will not get timely follow-up appointments or treatments. Newborns in critical condition may not receive intensive care as needed. The list goes on. You are holding the entire public healthcare system hostage to further your selfish political agenda. Furthermore, manpower allocation becomes much more difficult as some affected patients require time-sensitive treatments or surgeries, such as neonatal ICU, regular ICU, oncology units, surgery theaters. Any deaths that occur due to the staff shortage as a result of a strike will weigh on your conscience for the rest of your lives. Our community will never forget your decisions to abandon your patients. Immigration policies must be left to the politicians to deal with. It is not your job to play politics with the lives of your patients. You should also remember your oath. I will foster the honor and the noble traditions of the medical profession. I will maintain the utmost respect for human life. By using the health and well-being of your patients and the general public healthcare system as a political currency to intimidate the Hong Kong government into immigration decisions, you are bringing the medical profession into disrepute and are acting in breach of your oath. The message you are sending to the public is that your lives or politics are far more important than the patients you serve and profess to care. With the hospitals in Wuhan being inundated by patients, do doctors, nurses, and staff in Wuhan go on strike? Do they complain about having too much patients to deal with and initiate a strike to force the government to close hospitals? Would this be acceptable in any other society? The medical profession always carries with it risks, especially during times of epidemics and other major crises. This is what you signed up for. You can not only accept the good times, but not the bad. To protest for border closure is one thing. To use the welfare of patients in fighting for your protest is another. You have low risk at the moment in striking, but your patients have everything to lose. Where is the medical ethics in this? Where is the moral justification for this? Ask any medical group outside of Hong Kong whether you are doing the right thing by putting patients' welfare at risk. You also remember you said that I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. For doctors, please be reminded of the oath you have took when you joined the medical profession. For nurses, please remember your standard of personal conduct when reflected on your public image and instills public confidence in your profession. Public health interest always surpasses political interest. If you cannot fulfill your duties as a public healthcare worker, you should resign instead of striking and continuing to take a salary. Doctors and nurses work in unimaginable working conditions all the time on all continents, from wars and famine to Ebola outbreaks. Do they complain about being inundated by patients and go on strike? And even if working conditions deteriorate, is that reason enough to go on strike? Will you go on strike just because you feel inundated by patients? A patient is a patient, regardless of creed, color, nationality, political views, sex, or race. Your obligation is to treat them all to the best of your ability and not to abandon your post at the first sign of weakness. This is your sacred duty which you freely choose to accept when you entered this profession. As you continue to forsake your ethical obligations to your patients with the reiteration of duty, know that the Hong Kong public will forever remember you as the few who left your positions at such a crucial time, just as we remembered the heroes who didn't join SARS. The brave men and women of the medical profession fought vigilantly and tirelessly without complaint during SARS, as it was their sacred duty to uphold public health. We strongly urge you to drop your industrial action and return to work. Hong Kong is in a critical stage of fighting the epidemic, and we need all hands on deck, just as we need all medical staff to fight SARS. You remember you said, I made these promises solemnly, freely, and upon my honor. For those HA staff who continue to uphold the fort by remaining on duty to strike to serve their patients, we thank you from the deepest of our hearts. And we also thank you on behalf of all Hong Kong residents who need to use the public healthcare system. You are the heroes of Hong Kong's people in their greatest time of need. For those volunteer private medical practitioners and nurses who are helping out, we also thank you for your service, and the people of Hong Kong thank you for your generosity and for fulfilling your solemn preach to devote your life to humanity by the Law and Welfare Concern Group, the Medical Conscious Group, in alphabetical order, written on 6 February 2020.